Hello, ladies and gentlemen. If you're just tuning in now, this is the Defining Decade, and I'm today your host, Julius T. Every week, I'm here on this platform at Blaze TV, hosting amazing and beautiful people with a deep knowledge of things to help you help yourself in this defining decade. We live in a time where the world is changing so fast, things are changing so fast, life is evolving at a very at a fast pace. People who are alert, alive, and awake and ready, people who are resilient, people who are highly energetic, people who are ready to make it are making it, people who have ideas, who are not sleeping are making it. Why? Because it is the defining decade. Your actions now will give you the results tomorrow. A lot of people are comfortable in the cemetery of past achievements. I encourage people every day and I tell them yesterday is gone. We have to focus on today for a better tomorrow. Yesterday is gone, people. We focus on today for a better tomorrow. Whatever you do now, whatever you do today is what matters for the result you will obtain tomorrow. So don't get comfortable. Ladies and gentlemen, this is the defining decade. And today we're going to be talking about a very important topic. And I have an amazing guest in the house. Before I go ahead and introduce my guest and bring her on, I want to play with you guys a few intro music videos that we have for the show today. As I play it, please go ahead and share the live feed wherever you are. You don't want to miss this beautiful show today. Let's listen to Minister Eta.
Everybody testifies that you are so good. All the little things you've done just to beautify my life. All the little things you've done, yeah. Just to beautify my life. All the little things you've done, yeah. Jesus. Thank you for your miracle, for your love, for your compassion. Nobody like you. Hallelujah. Your life will never be the same again. Your story will never be the same again. God's hand is here to rescue you. God's hand is here to transform you.
Powerful, beautiful, beautiful.
Didn't mind the pain. You gave it all for me. The precious blood poured out on Calvary. What an awesome sacrifice. For me you bled and died. You gave yourself, oh Lord, to
Awesome. So, ladies and gentlemen, if you are just joining in, those were some amazing releases by top gospel Cameroonian ministers, Minister Eta, Queen Judith, and of course Bella. Bella is based in Maryland. Please do well to check them out on YouTube. Again, those of you just tuning in, go ahead and share the live video. I'm also doing that right now, inviting people to join. You don't want to miss this show today. I have the Queen. The Queen is going to be live with me today, so you cannot miss this for any reason. We're going to be talking about the importance of health and healthy living. Why? Because a lot of people neglect their health. A lot of people neglect being okay, being healthy. People eat anyhow, people live anyhow, and as a result, that's that could explain why there is a shorter life expectancy in most families, in most communities, in our African system, and of course in other parts of the world. And so I'm bringing on the Queen today because she has an expertise, a deeper background into health, healthy living, and best practices so that you can be able to be strong, energetic for this defining decade. Um, Ladies and gentlemen, I'm not going to waste your time. While you're still sharing the live feed, let me go ahead and invite the queen. The queen, the queen, the queen. Ladies and gentlemen, are you ready? Are you ready? There we go. Look at her looking all beautiful. All right. Hi, Madam JT Shalom. It's good to have you today on the show.
Hi, hello everyone. Hi, Mr. Julius T. I'm glad to be here today.
Okay. Yes, ma'am. It's an honor to have you. You know, you look. I must say, you look phenomenal. You look beautiful, as always. A beautiful smile, of course.
Thank you, baby.
Yeah. Um, so this is the defining decade, and I'm going to be your host today. It's an honor for me to have and to host you. What a privilege I consider it, because it's not easy to catch you on a day like this. I know you're very busy with a lot of stuff going on, you know, school, family, and business as well. So it's an honor and a privilege for me to catch you in this time. We are here because we want to explore your insight. We want to uh, dig deep into your depths and tap out the knowledge that we need to be able to stay strong and healthy in a defining decade. My understanding of this, the times we live in, is that I've been encouraging and coaching the young people, and of course hustlers out there and people who mean it out there, to work hard. Why? Because I believe that you work and then you earn. And it came to my mind that while I'm coaching and encouraging people to work hard, I might as well also encourage them and teach them and show them how to live healthy while working hard, because people work so hard sometimes that they don't care about themselves and about their health. And that is why I decided to seek your indulgence today, you know, to bring you on the show, you know, so you can talk to them about health and the importance of healthy living. But before we get into health and healthy living, we're going to have to know a little bit about you. Okay. I know so much from my findings. I did quite some findings about you. And I think I was able to see a little bit, you know, about you. I'm going to share a little bit of what I know about you. Correct me if I'm wrong in some places. And once I share a little bit, you know, I'll also give you an opportunity to talk to the viewers about yourself in just few words, and then we can go from there. Um, but before I do that, give me 10 seconds, really quick, while I share the live feed. For those who are just joining in, please go ahead and share the live video. We're about to have a blast of a show. Today, I have the queen of our blaze. I have Madam JT Shalom here, and she is going to be sharing with us some important health tips for healthy living in this defining decade. So don't miss this for any reason. Go ahead and share the live feed wherever you are joining. It's a beautiful day here in Houston, Texas, baby. And I woke up today. I haven't done so much. Just got ready to have this excellent show with you. I cannot lie to you. You look so beautiful. You know, um,
Aw,
to your husband, he's a blessed man to have such a beautiful uh, queen like this in his life. Okay. Anyways, we are not here to talk about your husband and yourself. He's a blessed man. We're here to talk about you for now, and then of course let you drill us a little bit on healthy tips and healthy living. Now, from what I know about you, you were born there in Cameroon, West Africa, in Cameroon, in Bamenda, precisely, if I'm not mistaken. Like I said, correct me if I'm wrong. I also do pray that where I'm wrong, you know, I will not be in trouble after this. You know, I'm just, I don't want no smoke. I'm just doing what I gotta do. So you were born there, and you grew up, and you grew up in the church system, of course. Your dad, Reverend Umaru, and your mom, Mama Rebecca Umaru. You have three brothers as well. There is a Glory, there is a Benz, and there is Bekema. You know, you are the first of these three young guys, which means that you are the only girl in your home. It's
mm-hmm.
beautiful. It's a beautiful family. I know your dad pretty much well at a personal level. He is my spiritual father. He is my mentor. He's also my music instructor in the days that I was learning music. He's the one that taught me a lot in music. So I'm pretty much close to your family in that light. And prior to me being closer to your family, I have been close. I remember the days back there when you all used to live in the Maitri, the FGBI compound. I used to come over
Mm.
there a lot, not for the reasons that I have now, but for my music reasons and of course my spiritual growth and all that good stuff. So
Yeah.
you graduated with your ordinary levels there in Bamenda, if I'm not mistaken, the Full Gospel Secondary School in my four, and then of
Mhm.
course you proceeded to St. Paul. I'm not reading this from anywhere. That's to tell you how I do my homework. You proceeded to St. Paul there in my tree, where you did your high school and you graduated with your advanced level, doing pretty well. And by the grace of God, God opened you the doors into the medical school there in Cameroon. And for the past, I think, 6 years now, you've been studying to become a medical doctor, and one more year to go, baby. So hang on there, one more year to go, and you are that close. And it's amazing for me to have observed this progress, this growth, the impact that you have, in the lives of people, as a result of the knowledge you've obtained. And then also, I'm not also going to not mention the role you play in through your church activities, of course, as a choir leader, growing the people there in church, the influence you have in the community and the life of other young persons like yourself. So I can go on, and we can stay here all day talking about you. It's such a blessing to have people like you in the society today who only mean good, who want to grow the system, who want to make people better for themselves. So I know I've been talking too much. I'll let you say a few words now and introduce yourself to this beautiful audience.
Okay, thank you very much, Mr. Julius T. um, I think you said everything. JT Shalom, Nisi Shalom, and about my background, you said everything. And I'm happy to be here. I'm just happy to be here. I don't. There's nothing else I can say. You literally said everything.
Okay. Well, yes, I did forget one very important aspect that which is your status. You are married. Greetings to your husband. Do extend regards to your husband for me after the show, for letting you have this opportunity with us on the show. Of course.
Oh
Um,
yes, shout out to my loving husband, to my sweetheart, to my baby. Um, he's an amazing person and a
uh
blessed woman. So I'm really grateful to God. And shout out to my parents, Reverend Umaru Emmanuel. Shout out to my mom and my colleagues who may be watching, and the church. Yeah.
Of course, of course. A big shout out to all of you out there watching as well. For those who are just tuning in, please go ahead and click on the share. Share the live feed, wherever you are. We have a few people in the comment section. Abongwa Ibon. I don't know why everybody is commenting with laughing emojis.
Hey,
I
Dr.
guess.
Mayuma. Oh my God, baby, that's my doctor. She's so dear to me.
Oh,
She has
Gwanyama
taught me
Noela.
a lot. Yes, Dr. Guanya
Oh,
Manuela.
oh,
She is
beautiful.
the founder and CEO of Talk Pregnancy with Dr. Nuela. So everything related pregnancy, every get to her.
Oh,
She's a
wow. Okay.
coach. She's a mentor.
All right. So we have Rita Felix saying hello. We have Barry Christel laughing. I don't know. I don't think we are comedians. Even Dr. Jap New Joyber here is saying that we are mad. We have our beautiful Gilga Achu in
Oh,
Douala.
baby, at you.
She's saying that that's my doctor and laughing emojis. I think, baby, I think that we should be comedians because everybody is laughing. We have our daughter here, Princess Maureen Foba,
Yeah.
and she's like,
Oh,
"Why is this funny?" We have Abongwa Yvonne, of course. We have Madame Rudy Funwe, Madame Rudy Funwe.
yes.
Yes, of course. We
Able
have
manager.
Numfor Emmanuel Niba. We have Berry Christel. We have, of course, our beautiful Princess Geraldine Foba. We have
Geraldine.
Nancy. our beautiful Nancy, all the way
Oh,
from Namibia. Yes, yes, yes. We have a whole lot of the family, the community on here watching and enjoying this beautiful show with us. Now, let's get into what matters. I know that they're here to learn. Let's not focus about this. But again, thank you for being here today. Let's go ahead and just get into it. Now, I brought you on here, woman of God. I brought you on here so that we can talk about something that is very, very important to our communities. And I've titled it The Importance of Health, Education, and Healthy Living. The importance of health, education, and healthy living. Now, I got you to talk about this not just because of your passion to see people live longer, live healthy, but because of the knowledge, the extensive knowledge that you have into this. So I want you to speak from a place of being real. Tell people what they have to know and what they have to do to make themselves better. My goal is that as we are out there hustling, we should take care of this body. Because if the body breaks down, we will not be able to even hustle anymore. So that is why I brought you on here. Now, the very first thing we're going to focus on is health negligence. Health negligence, and there is something I call the assumptions people make when it comes to their health. Now, what can you say about health negligence and, of course, the assumptions that people make when it comes to their health? Yes, ma'am.
okay. First of all, I want to say, what is health? We're talking about health. What is health?
Hmm,
Health, in simple words, is a state of being free from illness or injury.
hmm,
According to WHO, health is a state of complete physical, mental, and social well being. So it's an all round aspect. It's not just
hmm,
physically, emotionally, mentally. How are you doing? That
hmm,
is what health is. And that
hmm,
is what we are here to talk about. And unfortunately, in Cameroon, in our system, health is something that has really been neglected because of some beliefs
hmm,
that unfortunately we have.
hmm,
Um, and it's really sad because sometimes patients come to the hospital and you realize that it's a chronic disease that has been progressing for a really, really long time. And if people were really conscious about their health, they should have discovered these things way before. For example, for people to do routine checkup, routine screening, let's say annually or every 2 years, in our setting is really difficult because
that-
people feel like as soon as they get to the hospital, the doctor will declare them sick. As
hmm,
soon as they get to the hospital, the doctor, something must come up. Whereas that's not the case. We just screen you for basic tests and we make sure that everything is going well because
hmm,
things like for example kidney disease or kidney failure,
hmm,
these things, when we catch them early, the prognosis is better. And
hmm,
usually the symptoms manifest at a later stage of the disease.
hmm.
So when we screen you earlier, we can easily catch these things. And also, there's also this belief about C-sections for pregnant women. When they tell you that they have to operate you, or the devil is at work in your life, the Lord is no longer with you. I don't know if you can hear me.
So go ahead. The internet was disturbing. Go ahead.
Okay. So I was talking about operations like
Yes.
C-sections for pregnant women.
Yes, ma'am.
When women come to the hospital and there's a complication, and you tell them that okay, we have to get into the operating room, we have to operate you. It's an emergency. These people, oh no, it's a spiritual attack. The
Hmm,
devil is fighting. And
hmm,
then you see how they delay and they delay, and soon these children are born with complications. There are complications even for the mother herself that result in death, result in a cerebral palsy for the baby, and a lot of these things. So it's really important that some of these beliefs, and it's really sad when we talk about mental health as well in our system. Depression is not something an African should talk about.
hmm.
Mental issues is not something an African should talk about because we are strong. We cannot be sick. We are Africans. We're blood really strong. You
Yes.
see now, and it's really sad because people be going through issues, and because of all of these beliefs and stigmas surrounding these things, they have to stay back, and so that's the whole thing.
So let me cut you right there, baby, and add to say, sorry, Madam Shalom, but adding to say that, uh, I keep, if I make that mistake, please take it easy on me. It's just a habit, you know, it's just a habit. I wanted to say that people have these assumptions and this mindset when it comes to their health, and that it causes them to neglect their healthy state at every stage, like you're saying, right? Which means that you're just talking about the kidney disease. You said something like when it is discovered at a later stage, there is no much we can do at that point in time, which means that early diagnosis of a disease or of a challenge in the system can easily, you can easily find solutions
And
to.
ease the prognosis, yes.
Exactly, can ease the prognosis. But then
Mhm.
we go on the assumptions that, oh, I mean, we cannot be sick, or I'll be sick. I'll go to the church. The pastor will pray. I'll be well, and that's it. And
Yes.
I always like to say that sickness is also a natural phenomenon. It's okay for people to have the flu and so on. I remember when COVID came out, everybody in my system in Cameroon, while here everybody was running to use a face mask and take a test to keep themselves safe. My people back in Africa were saying that, oh, our blood is strong, we
Yeah.
cannot be sick of this. And so they completely disregarded all the measures that the authorities put in place, the World
Yes.
Health Organization put in place for safety. There is still congestion. People really, at that point, I realized that people don't care about their health. So now I want to
Yes.
say that I think it's a thing of the mindset, right? These
Mhm.
assumptions and all these status quo that people live when it comes to their health is a thing of the mindset. Here in America, every 6 months, when I don't go for my checkup, my doctor calls me and he said, Julius, we haven't seen you for your routine checks. What is going on? So in my
Yeah.
mind, the same way I grew up with that mindset, I'm thinking, why is this doctor bothering me? I feel fine. I don't need to go. Now, when I go, she checks me. She said, oh, you're okay, but I'm going to recommend these vitamins for you. I'm going to recommend this. Go now and buy them. You know.
Yep. It's
So I
really
really never
important that
understand. Yes, ma'am.
people
Go ahead.
um they like routine consultations, routine checkups. You need to check your kidneys functioning well? Well,
Mhm.
how is your liver doing? Am I doing okay? How is my heart? All these things are important, and especially for women.
Mhm.
Every year or once a year at least, screen for breast cancer, or go for a screen for cervical cancer, because all of these things, there are just little details that we miss, but when they start to manifest, is really, the outcome is not really really so good.
That's true.
So in Africa, we need to be mindful. We need to get rid of these assumptions that if I go to the hospital, the doctor will automatically say that I'm sick. No,
Mm.
it's for your good. It's for us to catch anything. Some people, there are diseases that run in the family. You see, for example, if your father had colon cancer, we need to screen you. There's a time that we need to screen you to prevent the occurrence, or so that we catch it earlier. There are so many of these things: diabetes,
Mhm.
hypertension,
Mhm.
and there's even sexual promiscuity, because people are promiscuous and you don't know that they have caught AIDS. But if you come to the hospital, these things can be seen earlier and they can easily be controlled. So it is really important that routine consultations
Hmm.
be really followed.
Wow. You just said two things there which I want you to throw a little bit more light on, right? Let's talk about stuff like diabetes, is it high blood, and so on. Which, because let me even back it up a little bit. Blood type.
Yes,
Okay.
yes.
Go
You've
ahead,
even
ma'am.
spoken about time. A lot of people don't do let me put it in the class of premarital screening, because I'm a
Mm.
church girl. You
Yes.
know, during this screening, we screen you. Some people don't even know their blood group. You don't know if your rhesus positive or negative,
Mhm.
especially for a woman. Because if you don't know your blood group, and let's say you are blood group A, rhesus negative, it can affect your pregnancy,
Mhm.
because it's a whole mechanism. I cannot really get into that. But these little details are important that we check. For example, diabetes and hypertension, the things we consume. The diabetes occurs for different reasons. Sometimes there are genetic reasons, and sometimes it occurs in the youth. There's juvenile diabetes, and then there's the one that occurs in adults due to several different factors. And if you come early and we screen you for these things, it can easily be controlled.
Mhm.
Even hypertension. If there's a history of hypertension in the family, you need to constantly screen yourself, because there are different causes of hypertension. Sometimes it occurs normally, just primarily no cause. And some other times, there's an underlying problem. There may be a heart problem. There may be a kidney problem. There may be an endocrine problem. So all of these things, early screening improves the outcome of the disease or the prognosis. Because when you come at a complicated stage, for example, if you come with a kidney disease and you're already at the final stage, it's really hard. It's really hard. The management is really hard. So
No, don't
so
read this
it's
comment.
important.
Don't even mind this comment. The thing that I'm not, you are so beautiful, but I'm hearing you. Go ahead.
Yeah. So it's important for us to do early screening.
Early
And for
screening.
women, breast cancer, even screening during pregnancy, antenatal care. There are many things that we need to prevent you from transmitting to the child. For example, if you have syphilis, we need to catch it early. We need to treat it early at a particular time, so you don't spread it to the child. If you have a toxoplasmosis, hepatitis, all of these things, they screen all these things during your pregnancy. But if you do not come for antenatals, many women, when they say, "Madam, come for antenatals," say, "Come for antenatals." No, that doctor is your worry. That doctor is your worry. Whereas it's for your good. And when these babies are born now with complications, you start to say, "Oh, the devil in my family is a family line."
Oh,
Something,
wow.
and it's really sad. It's really sad, and
Oh,
it's
wow.
really common in the church. That's what is pathetic, because the Lord is watching over my baby. I don't want to. I believe in miracles. I
Of
believe in
course.
healing. I
Yes.
believe in the supernatural move of God.
Yes, of
But
course.
there are systems that have been put in place, and God put his own people even in the medical sector, so that they can help you. So don't say that, "Oh, a woman will come to the hospital with complications during pregnancy," and when you tell her that, "Okay, this is what we have to do, it is an emergency," she's like, "No, the Lord is working for me. The Lord, and these children, they end up suffering the consequences.
There's so many questions coming in. I even want to answer some of them, but I don't even know. Somebody's asking what is endocrine problem. Somebody's asking what is juvenile diabetes. Some of these things, I know that we will have to bring you back more on the show, because it's so much to talk about. You see
Yes,
what I'm
I
saying?
think that if we have a particular topic, I can come and then I really take
We
time to
break down on
explain.
this. Yes.
Yes.
Health awareness, because we are mentioning a lot of things in passing. We've mentioned hypertension. We've mentioned diabetes. Today is my first day that I'm hearing that there's juvenile diabetes.
Even sickle cell disease.
Okay, even the sickle cell disease you're
Yes.
talking about. Now,
Yes.
even at the level of those blood groups you are talking about, you know that if you ask me now that what's my blood group, I'll call by my wife. I say, "Baby, what's my blood group again?" You see, because I don't even know that information. Even like you said, in the area of marriage, how they pair people in church. I have a friend of mine who got married, and he was not able to live long with this woman, because the woman had a complication, one complication like that. Even the kids that they gave birth to, I feel that they brought kids to come and suffer into the world
Yes.
because of those SS thing.
About what
That
you're
thing that
saying.
they draw it as a graph, and then they permutate SS versus A something. I used to
Yes.
do that in biology in Form 3. I remember.
Sickle cell disease. And unfortunately, it's really, really common, because people do not want to. It's come to stay now. Everywhere in the universities, it's come to stay. Oh, before you know, you have kids. But you don't really take time to go to the hospital, and because sickle cell disease, it doesn't affect the parents, but the children suffer. They go through intense pain. They have several complications. It's their whole life is a life of pain. It's a life of pain. And
That is
this
true.
could have been avoided if these two people who say that they are in love go to the hospital and say that, "Okay, we want to get married. Let us screen for HIV. Let us screen, let's do HB electrophoresis." That's to see the AS, SS. And let me just throw this out there. ASAS if two couples, if you want to get married, the best genotype is AA and AA. If you guys are AA, that's okay. If you have AA and AS, is manageable, because if you do that cross thing in biology, you realize that the children will not be sickle cell carry, they'll just be carriers, because
Mm-hmm.
there's AS. Sickle cell is is a dominant disease, so it manifests when it's SS. So
I
if you
see.
are AS, you are just a carrier. So you will not really manifest symptoms except in really extreme conditions that may cause your red blood cells to sickle. But in general, but now if you are AS and your spouse is AS, there's a problem, because
Mm.
that SS, that S and the S, you may have a child with sickle cell. It's
Mm-hmm.
worse when you are AS SS, because you know that one of your children must be a sickle cell patient. So it's important that you screen for these things and feel even for your children. Don't even, it's not only about love. Oh, love,
Mm-hmm.
love, because that child, what that child will be going through. No, it's really painful when you see what these people have to go through in the hospital.
Yeah,
In
that's
a
true.
week, sometimes they have to come 2 or 3 times. They are on heavy analgesics, pain medications. They have
Oh wow.
complications, kidney problems, heart problems, just from this simple thing.
Mm-hmm.
So it's routine consultations are really, really important.
Wow, wow. Thank you so much for that. I wouldn't really be able to relate to this because when I wanted to get married to my wife, all I was seeing was marriage in my head. I didn't even care me whether blood group is what, or AS, AQ, or AW is SS is what. You see now. So now you were the one that she was the one that was going to the hospital and checking all these things and telling me that, oh, let's this. But in my head, I'm thinking that, let's say I was AS and she is another AS, it means that there's that probability that we may have a child that is SS. I'm thinking that, so will I risk losing my beautiful queen that God has given me for this? So, which means that you are saying that we should discuss. Well, we'll get into this topic another day. So we should discourage marriages that when the blood group is like that, we should discourage it and so on. Well,
Yes,
I'm not gonna.
think about your baby. Think about the child. Think about what the child will go through. Because if
Wow.
you are to experience it firsthand,
Mhm.
then you will really understand why you will say no, please. And the financial burden, even on the parents, is a whole different thing, because
Wow.
of the complications that develop.
Mhm.
So it's not just about the child. If you see you're financially stable, that's fine. But what about the baby? What about the child?
I see. I see. Okay. Now let's talk about something very important, really quick. Um, there is a prayer warrior here in the comment section saying that we will pray and God will change the blood type, the blood
Yes,
group.
if God changes the blood type, that's fine. Then you can get married. But if God changes that blood type, please, please.
Okay. He said there's nothing too hard for God to do. Amen. You see, that's the faith that we profess, and of course, you cannot take that away from our communities.
Yes.
Anyways, now let's talk about sexually transmissible diseases, right? Which I think that is one of the major plagues in the consultations you guys have there in the hospitals on daily basis, right? You talked about sexually transmissible diseases that are there, but the people don't even know that they have it until after a while. And because they have it and they don't know, they even give it to a lot more persons. So what can you briefly say about that and the awareness when it comes to sexually transmissible diseases?
Okay. About sexually transmittable infections, I'll first of all start by saying this: prevention is very important.
Mhm.
Prevent these things before we have to start dealing with the consequences or whatsoever.
Yes, ma'am.
If you, if we're talking square on, right?
Hmm. Hmm.
Use protective measures. Use a condom.
Hmm.
That's because it prevents. How do I explain this? Use a condom. That's the prevention first of all. Avoid promiscuity. Before you get to lay with someone, make sure that they are safe. Make sure that, oh no, we have gone through, we have done this, we have done that. But if not, routine consultations, routine checkups will easily catch these type of things.
Hmm.
But sexually transmitted infections, chlamydia, gonorrhea, syphilis, all these things, the most common complication is infertility
Hmm.
in women. most especially. Men can have symptoms like offensive discharges, yellowish, greenish. They may even have some kind of rash lesions around the pubic area or on their genitalia even. But the most common complications is in the ladies,
Mhm.
because it causes what they call pelvic inflammatory disease, and it's a primary cause of infertility in women. So you see
Mm.
these women coming in a later stage, they have problems conceiving. Oh, they have terrible pains in their lower abdomen. They have this, they have that. They have pain during intercourse. They have terrible pains when they are menstruating. And
Mhm.
all of these things, the most feared complication is infertility.
Wow.
Yeah.
Wow, 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 wow. That's definitely deep. You know, I've had a few friends in the past that have had a different. They're just those, especially girls. They're just complaining of stomach pain. Just recently, here in Galveston, Texas, I have a friend. She got up and she was feeling a solid pain in her stomach, and she thought it was going to go away. She took the ibuprofen and so on, but it's not going away. And just one day later, it was an ambulance that had to transport her to the hospital. When she got to the hospital, apparently she had had a sexually transmissible disease, which happened to be what you just mentioned. That other name that I just called her, that is pelvic something something something.
Okay. Yes,
Yes,
pelvic inflammatory disease.
there we go. So it
Mhm.
has made the stomach. She was actually dying. The doctor said if she was not brought in on time, she would have died. So I was like, whoa, so these things do kill people like this. This is
Yes.
somebody that was healthy, and then the next day they were not healthy, and then the next day they were dying and going, you know.
Yeah.
So I was like, whoa. And now, why? Because it looks like it was there. She did not know it on time. It was there and it was eating her up, and it up to the point where she was on drip. She was on close monitoring, intensive care in the hospital for over a week before she was able to be brought back to normal.
Mm-hmm. Mm-hmm. So it's that serious. People should begin to take these things seriously. If you realize that you had unprotected intercourse and you're worried, just get to the hospital. It's that simple.
Mhm.
Get to the hospital, ask to do these tests. And for every woman, it's important at least once every year go to the hospital. Or
Wow.
once every 2 years, just go. Let them see if your cervix is doing okay. Let them see if you're not developing breast cancer. Let them see that, oh, okay, no, your tubes are doing. Those are not, if you have, for example, if you go and they screen you and they find that you have a sexually transmitted infection
Mhm.
early on, they treat these things, they treat them and they can completely go. But if you go when it has been there and you're developing the complications, those complications may be there for life, even
That
if
is
we completely eradicate whatever is causing the infection.
Yes, infertility is something that will be in life, and of course, these our prayer warriors in the comment section will now have to rely on God to, change that story around. So, which means that sometimes even this devil that we are casting like that, it was not actually from our mother's side or our father's side. It was just because we did not take care of our health. Thank you so much, Mama, for that beautiful, full submission. Now, let's talk about something I wrote here. I said the role of religion, cultures, and superstitions on health. Right now, this one is very important. Those in the comment section, please share. Please share this video. Now, the reason why I brought this up is because when I came to Cameroon, right, and we were that day. Remember that day we were in the bus, Mogamo, traveling from Douala to Bamenda, and that pa entered. When that pa entered, he just by me physically looking at him, I knew that something is wrong with his health. You see, but I could assure you that something is wrong with his health. His hair was not well done. His teeth were dirty, looking unkempt. That is a problem. That's a health problem. For you not cleaning your teeth is a health problem. It's a hazard to me. Uh, he was not well. He was not looking okay, to be honest with you. But he entered into the bus with a big bag, and he introduced himself as a herbal doctor in charge of something. And then he started selling. He sold skin seed, some seed that they harvest in the desert in the north, and they use that you
Yeah.
can chew with bitter cola or you can chew with two granite, and it helps you to cure a certain thing in your body. And then he also sold something. Where's that bottle? I brought
African
one.
fan.
African panacea. That one cures everything, you know.
Yes, it
So I
cures
wanted
everything.
you to throw some light on some of these herbal things, some of these things that people just buy in the box and consume. You have a toothache, they sell you something that is white, some liquid, something in the bottle for you to be putting in your tooth to take care of it. You have a stomach problem, they say that this thing will help you with the stomach problem. It will help you to get pregnant. It will help you to clean up your genitals. It will help you with flushing. It literally does everything that you can need. That particular African panacea can take care of everything 100% in the human body, according to that part. And so I realized that the problem is not money, as the people in the comment section complain about money, because even right there in the box, people were buying it. People were buying it and buying it like crazy. So, can you talk to us about the influence of the role of religion, cultures, and superstition on health and how that affects the people?
Okay, before I come to the role of religion and how it affects the health sector, about what you're talking about, when it comes to traditional medication, I don't really like to say a lot because it's a really controversial topic.
Mm-hmm.
And for example, African Panacea has helped a lot of people. Even Dental Pro, that thing that you put on your teeth, and then you also
Uh-huh.
put in your ear. What you use on your teeth, you put in your ear. Yeah, it apparently helps. But I will say this: um, if you have a problem, if you have a problem, because traditional medicine, it's a whole branch of medicine, and if you want to go by that way, you should go by a licensed, somebody who has been licensed and trained to do these things or to prescribe. That means they have gone to school. It's a
Mm-hmm.
whole different aspect of medicine. But all these other medications that you just see, oh, by the road, somebody is mixing this concoction, somebody is doing this. Be very, very careful.
Mm-hmm.
Because what they don't tell you is the complications that these people come to the hospital with.
Mm-hmm.
The effect that it has on their kidneys,
Mm-hmm.
because the kidney filters everything. You're
Mm-hmm.
taking these things, you don't know what is inside, you don't know the quantity, the dose of whatsoever is in it. You are
Mm-hmm.
just consuming.
Mm-hmm.
It has adverse effects on your health. It may
Mm-hmm.
be helpful, it may help some people, but what I generally say is, if you have a problem, if you have discharges, if you have pile, that's how you guys call it,
Mm-hmm.
hemorrhoids, if you
Mm-hmm.
have those things, if you have persistent stomach bite, gastric, you know, get to the hospital. Let them get you something to help you before
Mm-hmm.
you're coming and rushing to all of these things that may complicate your health. One thing may work for somebody else, it may not work for you. You don't know how your system is built. You don't
Mm-hmm.
know, So there's all of those factors that play.
There are side effects
Um,
to every drug, of course. That's what I know. You see now,
yes.
like for example, when somebody is having something is coming out of their leg and making the leg swollen, so they leave and go to the village so that grandma in the village they mix some concoction, or they go and see a native doctor that does
Yeah.
something and cook it and tell them that they should take that gallon of medicine, keep it and drink it for 2 months. So I'm even thinking that, does it ferment? Does it go back? It's a lot of different things there. And like you are saying, what are the side effects of this? Now, if that's a drug, what is the dose? How is that dose regulated? And so on. Now, you're also saying that these herbal medicines are not bad, but they should come from a licensed expert that has done a
Yes.
lot of experimenting on it, you know,
Yeah.
mhm,
Well trained.
well
Well
trained.
trained. Yes. Because traditional medicine is a different branch of medicine. We
Mhm.
have this is the white man system, you see that. But traditional medications have been existing long ago, long enough. And most of these medications that we have are produced from plants.
Okay.
So herbal herbs can help, but it's important for you to come from somebody who has been trained, who knows the right dose to give,
Mhm.
who knows exactly what they are mixing, who knows what is in this, what is in this, how does it help.
Mhm.
Because some of these things is just because we cut this grass and we gave this woman, it helps her like this. No, it will help everybody. What about the side effects of that
The
grass?
side effect
What if
of
this
that
person was
grass.
not supposed to take that
Mm.
in a particular dose?
Yes, ma'am.
We
Mm.
even adjust medications or drugs based on your weight,
Mm.
based on
Mm.
different factors, based
Mm.
on if you're immune compromised or not.
Mhm.
So if you what will work for somebody else may not necessarily work for you. So it's important that the right person, the licensed person, should be the one to prescribe these things.
Wow, wow. Thank you so much for that. I really want to talk about superstitions and cultures and religion like this because this is our problem. That thing like that is the heart of the reason why people die early or they don't know what happens to them. Unfortunately, baby, Madam JT, what happens is I've seen a lot of people collapse and die. You understand? And they say that they shot them from the village or that they send
Okay.
something to hit them to die. I've seen that happens a lot. You know, growing up, I grew up in a typical African system where there are no codes to health, right? If you are sick, the cook lives in the backside and give you to drink. There
Yeah.
was something one time when we were growing up, when we have a migraine, right? We were calling migraine frontal headache. Pretty much, it's migraine pain. Now, what my grandmother would do is that she will go down to the backside. She will go to the backside, and she will harvest one grass there, and she will come and she will
Rub
use
with
that grass. Yeah, the grass was really harsh, so she will use the tip of that grass and she will cut through my forehead like this with it. So she will put marks, wounds on my forehead. When she put marks and wounds on my forehead, she take cold water and she put it in my back, and then I will make like this. When I make like this now, and then she does this very early in the morning, and then she tells me that I should be looking at the rising of the sun. So I should focus my eyes in the sun. So I focus my eyes, and the sun is blinding my eyes, but she
Oi, oi.
forced me to must be there. So as that water is pouring my back, and I'm looking at the sun like that, she is speaking some words that let that of migraine disappear. And then when she does that, she said I should cover my eyes and go and lay down. I cover my eyes now and go and lay down for a while, and that to her has been the cure of migraine, and that's what they have been practicing. So I do not know the medical experts or whatever she does for that to work. I don't even know if it worked. I don't know if it's because I laid down that the migraine disappeared or what actually happened, but it's because of different superstitions and different belief system like this that a lot of people have died or have passed away today, right? Like I said,
Yeah.
people collapse and die. People just stand like that and die because of, like, those, we say, those diabetic patients, right? Those medicines, somebody just mix a concoction of different grass and they drink, and then it changes it, cause a certain catastrophe in their system, and boom, they just pass out and they die, and we start blaming their father and mother side. So it's important that you talk about this thing, the role of religion. Why are people not going to the hospital to check up, and they're only saying but that, oh, God must heal me on this, God must heal me on this? Is it that that's how it has to function, or what? The role of religion in our health.
You know that religion is a belief system that is really, really strong.
Mhm.
And people hang on to what they believe. People
Mhm.
anchor to these things that they believe. And sometimes in a negative way, sometimes people get even the scripture wrong. And it affects their health.
Mhm.
Because let me even just go to a simple example. I don't
Mhm.
want to say the group of people, but there are people who don't believe in blood transfusions, for example,
Mhm.
because of their faith. You
Mhm.
know, I'm not judging anybody's faith, please, but the repercussions on their health, because just a few weeks ago we had a patient that came and she was as white as no blood. She was severely anemic
Mhm.
and she had to undergo a C-section. They had struggled to prepare her so that her blood goes to get up to a particular level before they can conduct the operation. And even when she was in a critical state, she was like, no transfusion. She
Wow.
prefers to die. She prefers to leave her
Wow.
child behind, the family behind, but she doesn't want to be transfused. And it's really, really sad. I felt so bad because there are so many people who lose their lives for these kind of beliefs.
Hmm.
You know, Eh, there are even people who, like some of our mothers, they're like, that hospital this I need to go me for day because when they'll carry me, put me inside that machine so go kill me. Now that machine, when they go put me inside that machine, so so light come off of that machine, so that light go kill me. Nah, you know, we want to see what is going on with you. We want
Mhm.
to these tests sometimes are diagnostic, sometimes they're therapeutic, all of these things. But because of these beliefs that people have, they lose their lives. Somebody may just wake up and they tell you that, oh, today I'm having headache. You're like, oh, it's just light headache. The next two, after they keep telling you that they have this persistent headache, you're like, no, it's okay, it's headache. The Lord will heal you. The Lord, before you realize they're having a stroke, one side of their body is paralyzed, but they started presenting with symptoms way before.
Way before.
Somebody will tell you that I ever she don't my heart make so have you ever gone to the hospital? No. Till the day that you have a cardiac arrest, to the day that you have a heart attack, then you start rushing to the hospital. But you had all these symptoms earlier on. For, let's say, a pregnant woman, C-section, I'm coming again to C-section or operations. It's a normal thing. It's a normal thing. When you get in there, it's 15 minutes, the baby is out. And then they just have to close back the woman. It's not something so mystical, something that there are women that may never be able to give birth vaginally or normally because maybe their pelvis is too small. The child cannot pass, you know, or maybe they're having a heart problem or something that will not permit them. But because of this belief, religiosity or faith works to different people differently. Your faith works for you. Or somebody may not have attained a level of faith. You understand? So don't you have a patient and you're like, oh, this is what we're seeing. It's an emergency. A patient is seriously bleeding. And they're like, no, let me call my pastor. Let me call my pastor. If my pastor accepts that my pastor is going to talk to. Are you kidding me? Are you kidding me? You are between life and death. Is a 2-second something. Yes. And mind you, as when there's a complication, let's say the baby is suffering in the womb, the child is in distress. Even if you succeed to give birth to that child, the more the duration, you know, there's sequelae, there are complications. You see people with children who are born and they become like this, cerebral palsy. There are children who are born, they develop epilepsy. Because there is that neurological distortion. It can be genetic, but sometimes these things, we are the ones who induce them. Because we are like, no, let me wait. And these patients, when they call their pastor, if their pastor does not consult the heaven and the heavens approve, that patient is going in front of you and they are in the hospital.
My God.
And so it's really sad. It's really sad. So we need to know, we need to draw the line. Of course, there are cases where miracles occur. Miracles happen.
Yes, ma'am.
And we bless God. Sometimes you can even pray and things change. I'm not against that. But we need to also be sensitive to God, to the voice of God. As children of God, we need to know when God is like, no, it's okay. Go ahead. Don't keep saying that, no. God has placed these people in the medical sector to help you or to come through for you. So I have to call my pastor, and you're dying, and you lose your life, and the child loses their life, you know. So these things are really important. As Christians, we need to change our mindset. Medicine, God heals. He's the greatest physician, no doubt.
Yes.
But there is a system, and God has allowed this system. There are people that God heals. There are people who come through this system. When you come and your life is in danger, and the medical, they are trained, and they're telling you that this is what we need to do. There are even patients who argue with the doctor. They are like, no, doctor, my mommy pastor be telling me, say, for a time, when she was in labor, they be do so. And then she finally gave birth. I'm like, dear, really? Really? Your mommy pastor.
Wow. Ladies and gentlemen, if you're just tuning in, we lost her for a second there. We're going to get her back in a little bit. But this is something. She said something very important. Say, my mommy pastor be telling me, say, how can you be in between life and death? And you are relying on information of something that happened to your mommy pastor years ago. Well, we have a few comments here in the comment section. Mr. Bliss Chichi said Jesus had a physician among the 12. That means that there is space and need for physicians in the church. That is true. Madam Shalom said, God allowed these people to be trained so that they can help you so that you can live healthy, you can live okay, you can be strong. Stop relying on superstitions, on belief systems that will not help you in any way. Your mommy pastor said that what happened to your mommy pastor 5 years ago is not the same thing that will happen to you. Your own body build is different. Your own mechanism in your system is different. Allow the professionals, the trained professionals, to help you during blood transfusion. No matter what, it is saving you. It is not for you to live another person's life. This is to save you. Allow the doctors do their job. We should not be caught up with superstitions and beliefs and things that will destroy us. Mr. Bliss again is saying that the medical personnel will cure you. They will go to Jesus for healing. We should be able to draw the line between the two. Exactly. We should be able to know this. I did say earlier that sicknesses sometimes are natural phenomena. It is okay for you to have a flu, to have cold. When you have it, there is a medication that has been tested and proven by these trained experts that were inspired by God himself to make these medicines to help you deal with that flu, deal with that particular challenge in you. Allow these things to help you. Don't stay and die because of this. A lot of people died of COVID in our system, not because they could not survive it. It's just because they refused to go to the hospital for checkup. Some had the mindset that, oh, those vaccines were rigged or are rigged with something, so they refused to vaccinate themselves. Even when they refused to vaccinate themselves, they refused to use basic face masks to protect themselves. As a result, they caught COVID. Some said their blood is strong, they will not die. These are mindsets that are killing people, that are destroying people. Ladies and gentlemen, this is a good show. I'm not going to lie. I did so well. I know. I'm proud of me. I want to thank me for bringing such an amazing guest. I do have her back on, Madam JT Shalom. I'm going to just call it baby. You're welcome. Your insight is phenomenal. It's exceptional. We have a lot of people in the comment section saying a lot of beautiful things about the show. That thanks JT Shalom, because it had to take some people out of the comfort zone. That is my very good friend Cyprian Chifen from Atlanta. He's based in Atlanta. We have this woman of God, Kelly Vera. Prophetess Kelly Vera. We strongly believe in miracles, but going for medical checkup is not a sin. This is a woman of God telling you guys it's not a sin. She said it is very, very important that we look in the Bible. Luke in the Bible was a medical doctor, so he wrote his account from a medical doctor's perspective. Mr. Chichi is saying that among the 12, there was a physician, which means it's okay. The skills of a physician are given by God so that they can study, have themselves approved to take care of each and every one of us in our communities. Now, keep going. I don't know if I caught your thought, if you can remember where you ended, if you want to keep going on there. Yes, ma'am.
What was I even saying here?
We were talking about the influences of religion, culture, superstition on health. Okay. You were talking about how some mommy pastors, somebody will be in the midst of life and then they say, oh, my mommy pastor, this happened to my mommy pastor, and that this is what she did to be alive.
Yeah.
And all of that. Yes, ma'am.
And most of the time they are there in the labor ward with their mommy pastor. The mommy pastor is like a
that's the amazing thing. They're coming to give birth with mommy pastor. Yes.
In the hospital here, where I'm currently studying, they don't let them enter the labor room because there's this influence, that she finished that mommy pastor. Sorry. Many times, can you hear me?
Yes, we can hear you. Go ahead.
Yeah. So many times you find a patient in a really critical situation that needs emergency attention, and they're telling you that if their pastor does not approve, they're even calling the pastor is not even picking. Maybe the pastor is sleeping, is really late, the pastor is not even picking. But if their pastor does not approve, no, they cannot go ahead with it. It's true that there's an influence, a spiritual authority over your life, but as a child of God, you need to be able to hear God for yourself. You need to be able to understand what God is telling you at a particular time. Because is most of these things are emergencies, is life and death. So even if you are considering only yourself, what about the baby? When that child comes out and the child has a small, maybe the child is like this. So Don't get me wrong, some of these things just happen. But some of the times we are the ones who cause these things to happen. And then you start to cry and you say, oh, God has not been fair to me. God, my child, God, my. But these are things that could have been avoided.
Yes, ma'am.
Routine checkup, prompt response to a medical diagnosis or treatment is not a sin. It is not a sin. If you
Amen.
go to the operating room, they operate you, it is not a sin. You
Yes,
have
ma'am.
not sinned against God. Your ancestral spirits are not fighting against you. Some of these things happen.
Yes, yes, yes.
It's true that there
Oh,
is
yes.
spiritual attacks, but some of these things are natural. Some of these things just happen. Your pelvis may not be able to allow the child to pass for natural reasons. A woman who might have given birth the first time and maybe had a laceration to her cervix, maybe the next time the cervix does not want to dilate. It's because there had been trauma, first of all, to that cervix, you
Hmm.
know? So it just happens. Stop saying that, no, this, no, this. Nah, some of these things are natural. Allow the medical professionals to help you. Allow them
Wow.
to come through for you.
Okay.
This is not
Now,
only even.
just as an aside, when that mommy pastor is in the labor room with the doctors, what is her role? Is she praying or is she directing? What's going on there?
Sometimes they're praying, and sometimes their prayers work. Sometimes they're there for support, which is very important. I don't want Christians to get me wrong. I believe in miracles. I have seen miracles. But we need to be smart and sensitive to the voice of the Holy Spirit. And now, mommy pastor, they are also bringing that. And make sure that they hear from God. Make sure that it's not just archaic beliefs or country beliefs that is influencing her decisions. And she's like, no, no. For my own time, that's what the doctor be talk. That's what the doctor be talk. But at last born. Nami pastors, please let us also hear from God for ourselves. Let's not just be talking because, yeah.
Thank you so much for that. Now, let me come from another angle and also take down the hospital system. Can I say that the hospital system is also responsible for some people dying? Because I don't know if I should call them being untrained or recklessness or the inadequacy of medical personnel. That one is going to be a whole new topic, different topic. Let's not get there. That one is community, is government problem, or is the system problem. Let's talk
Yes.
about the recklessness of health experts that has caused the death of many persons. Right? You come to the hospital, they just carry a drip and put on you without checking and all of that. In your expertise, being in the hospital for all these years, what can you say about that?
I'm going to say that these things are possible, but these scenarios are very rare. I've not been to a lot of places, but where I'm being trained, like I'm saying, there's a whole meticulous system. Before anything is done, there is a system. Now, the people who are taking care of you have different characters. They have different personalities, different traits. That's why sometimes you hear patients saying that, oh, this person is very rude. This person is very nonchalant, So, because the relationship a doctor has with the patient or with the nurse has with the patient, it has a level, something to do with at the emotional level,
Yes.
because the way you relate with your patients, just the care that you give, is psychological healing to them. It's not even just the care. So maybe somebody is having a bad day, or just their character, so they are just naturally rude or naturally, which is not a good thing that we should I don't know. But these things of negligence or medical errors, they are possible because we are human. We can make a mistake, but they are very, very rare.
Very,
Before
very.
you want to blame the medical personnel, make sure you did your own part. When they
Yes, ma'am.
tell you that, madam, go and buy this thing, or Mr. Man, do this thing in this period of time, before you come back and it's too late and you're blaming them that they did this, do your part first.
Do your part first. Wow, wow. Thank you so much for that deep insight. I like that. Now, Now, which means that I have this point that says how to live healthy while striving for success, while working hard, while hustling. We've talked about it all. Just to reiterate some of the things that you have said that regardless of our belief system, our religion, and whatever we believe in, our health comes first, and it is very important. We should trust the counseling, we should trust the advice, we should trust the leading of our medical experts, our doctors, because they're not just giving you head knowledge, they have studied for years on this. And even with their study, they still have a system in place to take you through before they make their diagnosis. Now, diagnosis or prognosis is diagnosis.
Yes, diagnosis.
Okay, so trust me, the doctor in me is rising. You understand? My wife is a doctor, so trust me, the doctor in me is rising. So you've said that in order for us to live healthy, we have to take this thing serious. You said every individual out there should do routine checkups. Worst case scenario, even if it is every 2 years, that 2 years is far, but you have said even if it's every 2 years, they should just run normal checkup. We call it in America physical. Make sure that for women, the breasts are functioning okay. There is no
Let's check
cancer.
up.
We have cancer
Yes.
of the breast and they don't know it. Check that down
Cervix.
perfect and all those regions down there. For men, check on there's something that prostrate, something that men
Yes.
face a lot. Is it prostrate
Yes.
or prostate? What is that thing called?
The prostate is an organ. The
Mhm.
prostate is an organ. But when there's a disease of the prostate, you can have benign prostatic hyperplasia, prostatitis. That's inflammation of the prostate. You can
Mhm.
have prostate cancer. You can have all of those things.
Yeah, that
So
thing I
when
know
you
it will
get
collapse.
yes, yes, when you get to 40, this is for people who are getting of age. When
Mhm.
you get to 40, 45, those are things that you want to constantly go
Constantly
and
check.
check.
Oh
Yes.
wow, wow. So because that thing affects men, they cannot pee, so they have to go and they put something. God forbid. Anyways, let's not even get into some of these things. It's just depressing to know about them. Anyways, so you have said we should constantly check up, take care of ourselves, be aware before you just consume any herbs out there. You just buy anything from beside the road and you start consuming, which can bring adverse effects in your system. Make sure you do quite some findings. Are these people trained? Are they experts enough? Do they have they conducted experiments? Have they done different tests on this to know that it will serve this purpose? And what are the side effects of this thing that I am taking? You have made
Yeah.
mention of all of that. Ladies and gentlemen, these are
And
things that will cause you to live healthy, stay healthy in this defining decade. There is no need working hard out there and then you fall sick and everything comes to an end. For us to be effective in our day-to-day hustle, without us being healthy, we will not be that effective. So the health is first. I have this as a rule of thumb. So that's where I'm going to now before we can end. The rule of thumbs, right? And I have here, I say that what is, I title it the health rules of thumb, the health rule of thumbs, what you must know. My number one that I'll give before you give some more is that one, health first, which means that if a child begin say I the hurt, mommy, I'm not feeling well, the health rule of thumb is that don't even minimize it. I have seen a lot of our people in Africa particularly say that, oh, it's just her stomach that is biting. I know what it is. It will go away. You understand? Health
I'll buy
first.
flagy and give.
Exactly. How many times have you seen little children die in your hands in the hospital? That you cry. I remember in this house you've cried so many times because of that. Children just die. Health first. Why? Because the parents were negligent on the health care of the child. Health first. So talk to me about some health rule of thumbs. Must know things.
Okay. Like you said, health first. Um, routine consultations. You
Routine
know,
consultation. Yes, ma'am.
yes, routine consultations. At least once every year, once every 2 years. Go to the
Uh,
hospital.
your is back on. I don't know what was happening.
Can you hear me?
Yes, ma'am. Go ahead.
Okay. So routine consultations, that's one. Two, do not minimize any symptom. Whenever you have something that is persistent, or you feel like you constantly have headaches, you constantly have fever, even depression is
Hmm.
something that we minimize. You're always
Mm,
feeling low. You
mm,
you don't have the zeal to do some things, when don't minimize any symptom.
mm-hmm.
Always
Always. Yes, ma'am.
try to find out what is going on.
Mm-hmm.
Two, healthy lifestyle, that is exercise. Do exercises, eat healthy, be mindful of what you eat in a day, be mindful of the number of calories. Don't diet, but the quantity of meat that you eat per day.
You
Somebody
just
will,
most people in our system don't even know what is calories. You understand? No? As they take fufu corn and jama jama walk them, they just come out
yes, they
walk
go and buy
contrast,
pork.
just bubble.
Yes,
They walk them.
soya. You drink the Fanta, top and Primos, about 2 bottles in a day. You know, we need to be careful with all of those things.
Yeah.
So don't minimize the symptom, routine consultations, exercises, healthy
Mm.
living.
Mm-hmm.
It's also important to drink a lot of water,
Drink a
at
lot of
least
water. Oh, I like that one.
2.5 liters per day, 2 to 2.5 liters at least. It helps to cleanse the system. It helps so
Mm.
your kidneys function well. It
Yes, ma'am.
prevents kidney stones, all of those kind of things. It is important for you to drink a lot of water.
Yes, ma'am.
And um, yeah, I think that if you do that, at least you can maintain a
Okay.
healthy lifestyle.
Let me quickly run through these points again. Rules of thumb when it comes to your health. What you must know. Don't neglect these things, guys. Very, very important. She said, one, routine consultation. You must go to the hospital to consult. One person is telling me here that I hear some people say they have not been in the hospital for 20 years.
I'm
Sir.
telling you. I'm telling you.
Wow. Routine consultations, guys. Then she said, don't minimize any symptom. Means say if na your corner food the hot, check it out. If it's your eye, your tooth, whatever it is, check it out.
Let me
If it's
give you an
just
example of this thing, right? A
yes, ma'am.
patient came to the hospital. They had a small rash on their foot. It was just a small rash, like a pimple, and then they scratched the thing. In less than 24 hours, that foot started to swell. It became red. When you press the leg, it's like there's bubbles
Hmm.
under. The condition that we call necrotizing fasciitis. It is
What?
super. No, it's okay. Never mind.
Okay.
It is super rapid. You understand? But
Hmm.
and then that patient came about 3 days after. That thing had already eaten the food right up to the hip. When it passes the hip, there's nothing we can do again because it will just continue and eventually die. You know,
Whoa.
but it was a small rash. The rash became red. The rash is not drying out. You are sitting home. You realize that it's pain. You cannot really move on that limb. You are
Whoa.
staying home. To you, it was just a small rash.
Whoa.
In other cases, we are able to amputate the leg on time. It's a surgical emergency. You are not a health personnel. You don't know. So when you
Whoa.
have a little symptom that is persistent, or it occurs 1 or 2
Wow.
times, persistent headache, or no, you have heaviness on one side of your body, just started lightly, go to the hospital. Let them see and make sure that everything is going well. If it's something that they can catch early, they catch early.
Hmm. Wow. Wow. How a small rash had to lead to somebody's leg being amputated, which means if that person did not minimize that symptom, that person would have been for sure immediately. That person would have been in the hospital, and that problem would have been solved. That is
Yes.
crazy. That is just insane. Well, guys, you're hearing this. Do not minimize any symptom. Do not minimize any symptom. Now, she talked about healthy lifestyle, exercises, and what you eat. Exercises. It's okay to exercise on daily basis. Exercises is healthy living. Diet. That diet is not that you should only eat but some particular thing. No, she's not trying to put you on a diet. She's basically saying that watch how much you eat and how you eat. Calories do matter.
Yeah.
Immediately you wake up from bed, you just handle a big bowl of rice and beans. 2 hours later, you handle a lot of pork meat. You understand? Irish potato and egg, you heat it. You combine all those things. By the end of the day, you drink water and you are like that. And before you're coming like a paramount chief, heavily loaded like that because of the amount of calories you load in your system. Please, guys, watch your lifestyle. When it comes to food, exercises, and all these things. Now, she talked about something very, very vital. She said we should drink a lot of water daily. And she said the reason why we should drink a lot of water is to help us with cleansing, help our kidneys to function well, since our kidneys is what is literally the machine that powers the body pretty much, right? That at the
Yeah.
time of a find some word they will work the thing even come out somehow. But you all have heard it. Drink a lot of water every day. These are set basic things that we have to do to keep ourselves healthy. Now, one thing I want to add is don't just do this for yourself. Look out for your community. Look out for your brother, your sister, your parents. Your parents may be old, they don't understand some of these things. Look out for them. Look out for your own children. If any, sorry, I was lost there. I don't know why this network is disturbing. If anybody complains of any pain, whatever symptom it is, please immediately take it serious because it can lead to that person dying. It has happened too many times. We want to bring this awareness because in this defining decade, the next few weeks, the next few months, few years are very crucial. You are working so hard, you are out there hustling. There's a lot that you inhale when you step out there, a lot of chemicals, a lot of smells, a lot of things that you inhale, a lot of bad things that you eat every day. You have to also take care of your health. Be on supplements, be on vitamins, do things that will boost your immune system to be able to fight natural factors, natural phenomena. I talked that one lesson pro. Natural factors and natural phenomena that can affect your body. That is very, very important. And of course, do not forget the fact that the health system is there for you. It is not there to destroy or kill you. It is there for you. We're going to definitely have you again, madam, on the next show. Thank you so much for being here with us. I am honored. I'm excited to have had this insight. Now, any last words you have for the people before we bid you a farewell tonight?
I like to end by saying that we should not minimize mental health because it will reduce the rate of suicide that we
Mm,
have in our
mm,
community. There's a lot of people who are going through a lot of things. If you realize that all of a sudden you are feeling very low, it persists for 2 weeks,
mm,
you are feeling very sad, the things that you love to do, you cannot do them again. You constantly tell yourself, I will not make it in life. You are
mhm,
a pessimist to your
mhm,
own self. You
mhm.
feel overwhelmed, you feel stressed. Please, we should not minimize mental health,
Amen.
especially in Africa, because people are dying. We are
Mhm.
losing people to suicide. We are losing people to madness. We are
Mm.
losing people to a lot of these things. When
Love
you
this.
feel that way, find the nearest health facility and consult. Yeah, that's
That's
what I'm
right.
going to end.
So, as a doctor, should I go and consult in the hospital, or I should consult with my wife? Since my wife is a doctor, what's the advice? Should a wife consult her husband, or what should I do in
No,
this situation?
the husband should go to a health facility. I will make sure I will follow up because there is familiarity, there is emotional attachment that play, you know,
Mm,
it plays. So I may be biased, but I'd rather follow you up or I send you to somebody that is trustworthy and that
mhm.
person follows up and I'm sure of what they are doing and making sure that what they are doing
I
is
get.
right. Yeah.
Makes sense. Makes sense. Okay, I hear you. I hear you. But it means that you'll be monitoring my symptoms in case something develops that I don't even know. You'll be
Oh yes.
monitoring because the way I am, I'm one of those people that don't really go to the hospital like that, you know. So if you don't
Mhm.
force me to go and do this, or the doctors here call me and force me, I ain't going nowhere.
I got you. Don't worry.
Okay, well, I've learned so much. Thank you so much for your amazing insight. It was an honor having you today. We definitely want to have you again. And when we do, we want to be specific, talk about some certain illnesses. You break it down to us, diagnosis and prognosis, how to prevention and all of those things, and be realistic as much as possible. I know that you are busy. If sometime we cannot have you, we'll have some other colleagues of yours talk about this, because health awareness for all is highly important. Thank you so much. I do have a little surprise. I wanted to give you a little surprise from me to you. Of course, you do know how we are in this family, and you know that I like to do little surprises. But this time around, I want you to know that I'm proud of you. I'm proud of the knowledge you have, the depth of knowledge that you have in this. I'm particularly proud of the passion that you have to see people live healthy, to see people okay. You know, the desire you have, the vision. When you share with me your vision for health, what you want to do in Cameroon and of course in the world is mind blowing. Is huge, and I know that someday you will be in that position where you are able to.
This network is terrible.
Sorry, the network disturbed. But I was just saying some proudful moments, and you know, thank you again so much for all of that. Please keep doing what you are doing. Keep inspiring the communities. Keep coaching. Keep educating people, because without knowledge we're gonna perish. That's it. Just it. Um, it's an amazing. Since you've been with me in my life, of course, it's been amazing. The healthy living has been it has become normal. It's become normal for us. But I do appreciate that. Yeah. I have a little song here that is your song, that I wanted to bring some small love moments on the live feed, of course, because I know
Oh
that the
my
people are
god.
looking at it. The people wanted to definitely see that. Some do reach out, and they feel blessed by the network. Does not want me to do this, but I'm going to do it, and people are not going anywhere with it. So this is just a little dedication of love to you, um, on my show. I don't do this. This is not a routine. I just do this because you are my special guest today, and plus you are my queen. So I have to do this. So this is a song I wrote for you a couple of years ago. Right here in the United States, when I miss you a lot, and I think about you, and we have our moments like that. I wrote this song for you, and you know it so well, and it always means so much to you each time I sing it. So I wanted to do this little one to you, because I know that be it 100 times, you always will love it. I wrote this song, I played these chords, created this rhythm just to bring out the you in me. It started the music in me, that you are the music in me. I wrote this song, I played these chords, created this rhythm just to bring out the you in me. I stayed up.
Oh my god. Wait, this network.
I stayed up late, getting inspired by thoughts of you, baby. The song I sing is a you in me. I love this rhythm in my head. I love this feeling in my soul. I'm addicted to this music in me. This music in me. I love this rhythm in my head. I love this feeling in my soul. I'm addicted to this music in me. This
The
music in me.
music you mean.
Oh, cause you are the music in me. The sound in my head. The rhythm that plays in me. Love this rhythm in my head. I love this rhythm in my
In my
soul.
soul.
I'm addicted to this music in
Music you
me.
mean.
This
The
music.
music you mean.
Oh, you are the music in me, the sound in my head, the rhythm that plays in me. I play my guitar, sing a song, telling you the things that are real, cause I know they're real. Your beauty lies in and out. I play my guitar, sing a song.
Okay, was making me cry.
Sky is falling on you. I play my guitar, sing a song, telling you the things that are real, cause I know they're real. Your beauty lies in and out. Alright, that's enough. That's enough for today. So thank you so much, baby. Thank you so much for being on the show.
Oh,
You know, I cannot thank you enough. I cannot appreciate this enough. On behalf of the audience, on behalf of this show, on behalf of the entire Ablaze TV staff, our management team, and of course our host, we want to appreciate you for taking this time to be with us. Please make time to be with us again. It was an honor having you.
thank you, baby.
Much love. Goodbye for now.
All right.
All right, ladies and gentlemen, this was the Defining Decade, and I was your host, Mr. Julius T. here. We had an amazing guest, Madam Jetty Shalom, and the show was exceptionally amazing. Please go back and watch these videos. You have to help yourself. Next week, we're going to be having another special session with another special guest. Please keep following us. We have interesting activities, interesting programs loaded on this platform for you. We are coming to give you information that will help you to be successful in this decade, connect you, inform you, and educate you on all that you have to know. God bless you. Much love to you all from wherever you are. God bless. Bye.